Good morning and hello, and welcome to the third session of the four-part series of helping your company write a winning SBIR, STTR proposal. In today's discussion, Eva Garland Consulting will touch upon writing your research strategy, including the section-by-section overview in phase 1 versus phase 2. Today's webinar is hosted by ULP, University Lab Partners, in partnership with Eva Garland Consulting. My name is Teresa Fry. I'm the advanced coordinator here at University Lab Partner. As we get started, I'd like to take a moment to introduce you to ULP by showing you a little video.
Hi, I'm Karen Cook, Executive Director at University Lab Partners. University Lab Partners really serves three critical roles here in Orange County. First and foremost, we support life science innovators and entrepreneurs by providing wet lab space and critical infrastructure. Second, we serve as a landing ground for life science innovation. We provide networking and educational opportunities so life science innovators really have a place to call home. But most importantly, University Lab Partners serves as a catalyst in this region for workforce development activities in the life science space here. We truly believe as our companies are creating great jobs, we need to serve as an active agent to develop that talent pipeline for this sector.
What makes our hands-on laboratory experiences unique is the fact that they are led by our life science innovators that are actually here working within our space. These instructors bring their real-world experience and applications into the classroom as the students are using industry-standard techniques and equipment.
With our expansion here in the Orange County community, we look to serve more innovators and students all across Orange County.
I'm going to go back to our thing and talk a little bit about University Lab Partners, and we're a nonprofit premier wet lab incubator and accelerator program here in Irvine, California. We have over 22,000 square feet of scientific resources contribute to the acceleration and innovation in Orange County. Our benefits encompass flexible lab space, office space, state-of-the-art equipment, and access to UCI's technical core resources and on-site experts and residents. I'm going to admit some more people in. As we go through here, I want to talk about a couple of our other flexible spaces, and don't forget to connect with us. And then we're going to go through, and then I'm going to stop screen sharing, and I'm going to introduce you to Dana in a moment. But I want to give everybody a little bit of housekeeping before we begin. Everybody is muted. There'll be a Q&A at the end of the presentation, but feel free to put your questions in the chat box, and Brandon Turner, Dr. Brandon Turner, is going to try to monitor as best as he can. And if you have any other questions, we're going to wait till the very end of the session to answer them. So I'm going to keep going through, and I'm going to stop screen sharing, and I'm going to tell you a little bit about our presenter is Dr. Dana Upton. She's our grant writing specialist. Dr. Upton excels in aligning both scientific and business objectives to help clients successfully advance their technologies. Her scientific training focuses on DNA damage, repair, and replication of the context of cancer biology, immunology, and virology. I'm sorry if I said it wrong. She also serves as a biotechnology strategy and writing consultant for early stage companies, and was one of the leaders of the Wake Forest Biotechnology Case Competition and Conference. So thank you so much for being here, Dana, and I'll turn the presentation over to you.
Thank you so much for the warm welcome. I'm happy to be here today. And if you'll give me 1 second, I will get my screen shared and we'll jump into talking about writing your research strategy. So as you mentioned, my background is really focused on trying to help early stage innovators. I did my PhD and my MBA at Wake Forest, and I've been with Eva Garland for a little bit over 6 years now. So we exist to advance science and technology. And one of the ways that we do that is to helping bridge that gap and helping folks find that non-dilutive funding. So exactly what you're doing now is trying to get that grant funded. And a huge part of that is the research plan. So I'll dive into today's agenda. Let's talk a little bit about project scope, and then we will deconstruct what goes into an NIH phase 1 research strategy, and I'll do a little bit of compare and contrast with the NSF on that one. And then we'll talk about supporting documents. And then finally wrap up by looking at phase 1 versus phase 2, and then end on some tips for success. So in terms of project scope, what I tell folks to do is to really outline, if you know where you want to be at the end, what are the steps that it takes to get there? So you then can start looking at what's feasible within a specific project. For example, if you want to be a frog at the end, you have to go through all of the stages, go through being a tadpole, go all the way back to the cells. So go all the way back to the beginning, and then think about what each of your steps are. So in this case, we've got a 3-year project that's going to cost over $50 million. It's a little bit too big for one grant, but let's start thinking about what's feasible. NIH really likes about 6 months to a year is the sweet spot on a phase 1 application. And let's say $300,000. Well, in that case, we've got a 1-year project here if we combine prototype and feasibility testing, and it's within the right budget. So it looks like we've scoped out an appropriate phase 1 by putting these two pieces together. It also fits really nicely with, at the end of phase 1, you want to have proof of concept, and it seems like prototype optimization and feasibility testing will get you there. And then you can think about what comes next and what are those later stages and what type of funding can you get for those. So to go along with thinking about laying out your project, also think about your milestones. What are those go, no-go decisions at each one of these steps? You don't want to keep throwing money into a project that you know is going nowhere, but how do you know that? And how do you know when you've been successful and you're ready to move on to that next step? And so those go, no-go milestones really help you lay out what those key metrics are that you can then use to evaluate success. And it's really important to go ahead and think about this now, because you're going to want to include those in your phase 1 application. So big picture, let's talk about what goes into one of these things. You're going to want to talk about what's your value proposition. That's your significance section. How are you unique? What makes you have sustainable competitive advantage? There's your innovation. And then what are you doing to get to that next R&D milestone and all of the details that go along with that? And there's your approach. And so what we mean by this is, what specifically are you doing to accomplish your goals? What experiments do you need to do? How are you going about doing all of this? And again, how are you demonstrating that you've achieved those milestones, those quantitative milestones that are oh so important? To go along with all of this, you also need to describe who's doing the work and where they're doing the work. So that touches on team and environment. So let's start deconstructing what each of these things are. So big picture, we're wanting to align with the score driving criteria. And the ones laid out here on the screen are the ones that are listed for the NIH. NSF might call them something slightly different, but the big picture idea is the same. We're going to want to address the significance, the innovation, the approach, the environment, and then who are your investigators on your team. And underlying all of this is, what's the commercial potential of your project and your technology. So if I can give you no other advice today, my biggest tip of all is read the solicitation, because each one is different. And we want to make sure that we're addressing what the reviewers are going to be looking for. So my suggestion is get a copy of that funding opportunity announcement and make sure that you find the section that outlines what the review criteria are and if there are any specific special requirements. Some of the targeted solicitations do have some extra little things in there that you just want to make sure that you're aware of. So I'm going to talk about the older NIH and NSF funding opportunity announcements. We're waiting on the new ones to be released. I expect that to be just really any day now. NSF has been hinting at it for the last couple of days, so I think it's going to be very soon. For NIH, here's the information from 2023, so you can see how it's laid out and what it looks like in the solicitation, where they very clearly tell you here's what the scored review criteria are and how they're going to go about reviewing your application. And then they dive into the details of here's what we're looking for under each of these categories. So NIH is looking at significance, approach, they're looking at the overall impact. They also have in that FOA description of what they're evaluating for innovation, team, and environment. For the NSF one, theirs is laid out a little bit differently, and you'll see a bigger focus on market potential than you see in the NIH phase ones. So really important to go through and read those instructions. The other big thing that you're trying to get out of the instructions, not just how you're being reviewed, but also what are they reviewing. For an NIH phase one, you're looking at 6 pages and they have specific formatting guidelines. NSF, the formatting is different and it's 15 pages. The NIH does not have a minimum, but when your max is 6 pages, I don't think you're going to be able to get in much lower than that. NSF has a minimum of 10, so you have to have at least 10 pages for NSF. And then they also tell you how they want to see it laid out. For example, I always use the full 15 because I'm wordy. My first page is the elevator pitch, and they tell you no more than 1 page for that. And then they go through and lay out the rest of the sections that they want to see, like the commercial opportunity. Just make sure that you know what you're being reviewed on. Sorry, excuse me. Know what you're being reviewed on and be prepared to put in the application. So again, read the solicitation, find those review criteria, and then my suggestion is use the same phrasing, maybe some bolding and some underlining to make sure that they see that you're addressing it. Simplicity is good. Make sure that it's as simple and as easy to read as possible to make sure that they're seeing what you want them to see and they're getting your message. Again, don't leave anything up for interpretation. My suggestion is to also have somebody else read it and see if they come to the same conclusions that you do and that they think that it's easily read as well. They can also spot out gaps in logic flow. They can point out anything that they find confusing. Often that type of feedback will align with the feedback that you'll get from reviewers. So it's something to do before you submit and go ahead and get that feedback. Go ahead and address as much as you can before submission. There are also some really great resources online. I strongly suggest looking at the sample applications. The link here on the NIH sample applications goes to the NIDA website where those samples are. They point out some examples from NIAID as well. And I believe in one of the previous webinars, there are links to some of the other NIH resources as well. I will say I really like the examples on the NCI webpage as well. The NSF doesn't have a bunch of publicly available samples like the NIH does, but what they do have are office hours with the program officers. And they also have some recordings of their webinars. It's worth taking a look at those. And then SBIR.gov also has some tutorials on their website where they point out some tips and tricks and things to do. So let's deconstruct this and really think about the fine details of, let's start with significance and move on from there. So what I want to do with significance is really define the problem. What is that specific unmet need that you're targeting? And I think it's really great that you get to define the significance, because that way you can lead the reviewer to, here's the problem, nobody else has a solution, but wait, I do. So to go along with what is that specific unmet need, what's the impact of that unmet need? And anytime you can quantitate and put some numbers around it, either in terms of number of people affected, percentages of people affected, a dollar amount on the economic impact. This could be each patient ends up spending $100,000 out of pocket, or this is costing the US $1.5 trillion per year. Anything that you can quantify like that is a really great detail to include to show this big picture impact that this problem is having. You would then start introducing, here are the current solutions that are not adequate. And so why are they not adequate? Why are they ineffective? Or is there a specific aspect that's ineffective? it cures 100% of people, but we don't have a good way of delivering the cure, for example. I would suggest that you identify issues that you then have the answer for. What is different? Why do you have the solution? And again, provide as much detail as you can, and references are great to back it up. It's not just, I say there's a big problem. It's, I say there's a big problem, and here are my 10 references that show that it's a big problem. Again, anything you can quantify is great. A lot of times people think that just having a big problem is enough. It ought to be significant because it's a big problem. But really what the reviewers are looking for here, it's there is a big problem and I have the solution for it. So you're trying to convince them that you can do something about the big problem. So in terms of innovation, I like to briefly talk about who the company is, why the company exists, how long you've been around, and who's on the team. Why is this the right group of people to be able to address this problem? And then why specifically do you have the better solution? What's innovative about your solution? Is it some sort of patented process? Talk about the patent and the IP. Is it a novel platform? Is it a novel delivery method? What is that unique factor that's going to let you be successful? It's not just enough to say that you have the answer and here's what makes you so unique. You also want to show that the other competitors in this space don't have the same type of capabilities, that you truly have a unique answer. And what I love to do here is a competitors table. I have got my product in this column. I've got a different column for all my other competitors. And then on each row, I have one of my unique factors. And then I have a big check mark for myself and some big red X's for everybody else. Not only does it show that you know what makes you unique, but it also shows that you know what else is in the marketplace, kind of hinting at that commercialization plan that you have. A lot of the programs don't want to fund things that they consider iterative. So this is another way to go about showing the reviewers that you truly have something innovative and unique and novel that's very different from what else is out there. Again, IP is really important. Not only does it show that you've been recognized as having a unique value or a unique product, but it also is a way of, again, showing that you have that sustainable competitive advantage and that you've done something to protect that product. I also talk about my regulatory path, again, to give a hint at that commercialization strategy. On an NIH phase 1, you don't have a separate commercialization plan document. So I think it's really important to show that you're thinking about it and that this is why this phase 1 is leading you in the right path for your commercialization. That you know that you're going to be regulated by the FDA as a device or as a novel drug, and that you know what's required of you to hit that step. I like talking about the big picture, but sometimes it's also equally important to show that you know what that first target market indication is. It's not just I have a solution that's going to fix everything, which might look a little bit unfocused to reviewers. It's I have a solution that's going to fix these 10 different things, and I'm going to start with this particular thing first, and here are the details about that. So in your research plan, you've now laid out your significance, you've laid out your innovation, and this is when you start digging into your approach. So one of the big questions that always comes up is around preliminary data. And one of the questions is, well, is it required? And I'm going to refer you to look at that funding opportunity announcement and read the instructions again. If it is required, then make sure that you're providing the necessary details. What did you do? How did you do it? What were your findings? Why is this important, and how is it setting the stage for what you're doing now? I think it's really important to address rigor and reproducibility. So I sometimes tell folks to include some of the details that you might if you were publishing it. How many replicates did you do? How many animals did you use? What was the p-value on that? What type of statistical approach did you take? Important details to think about. If preliminary data is not included, well, the first thing to do is to figure out, is it okay to show preliminary data if you have it? Or is it one that says absolutely don't show us any preliminary data? Do they put a restriction around how much preliminary data that you're allowed to show? Make sure you know the instructions. Either way, if preliminary data is not required, you still want to lay out the foundation for why are you doing this and why are you doing this particular project. Again, if it's not required and it's allowed to be included, I would say include it. Reviewers love seeing preliminary data. So once you've laid out the preliminary data and really have that explanation for why you're now doing this step, to a degree, you've started de-risking the project with that preliminary data. What comes next? I like giving a big picture overview. In this phase one, we're going to do X, Y, and Z. And then I start digging into the details of each one of those things. So for X, I want to include that rationale for why this is being included. And then I want to break into the methods of how am I doing it. So how and what are you up to here? Feel free to include citations here. You don't have to include all the details. If it's a standard procedure and it's been published before, you can reference it and save yourself a little bit of space. Again, publication-like details are great. You want to include information about controls as well. Negative and positive controls are something reviewers are often looking for, so make sure it's easy to spot. So going back to those milestones and metrics, how are you analyzing what you've done? How are you measuring, analyzing, quantifying? And then how does that then lead into one of your metrics of success? What are the milestones that we were talking about earlier? Quantitative. It's one of the things that I repeat a lot to people when I'm helping them with their research plans. The reviewers want to see those quantitative milestones and metrics. However, keep them realistic. We're trying to come up with something achievable, and you want to give the reviewers confidence that you're going to be able to do this within the budget and within the timeline that you've laid out. So you want it to be realistic, but not overly ambitious to the point that they say it'd be great if you can do it, but there's no way. So you've laid out all of these things. Then you want to think about, well, what could go wrong? What are your pivot points? What are your backup plans? If this doesn't go exactly according to the way you've laid it out here, what's your plan B? What is that alternative approach? And what are the pitfalls that could lead you to having to use one of the alternative approaches? I've definitely seen reviewers call people out on, we love the plan, but you didn't address pitfalls and alternatives. So I mentioned rigor and reproducibility earlier. That's a really big thing at the NIH now. They want to see that rigor and reproducibility of the prior research, but also of the proposed research. I strongly suggest that if at all possible, include a power analysis and a description of your statistical methods. They want to see that you're addressing sex as a biological variable. They want to know how many replicates you're doing. What are your controls again? These are all really important things to include. And I would direct you, if you're going to go to the NIH has a great website that talks about rigor and reproducibility and tells you where to include these various pieces of information and even include some examples. It's worth taking a look at that website. So you've laid out in your approach your preliminary data, each aim with its rationale, with its rationale, with its experimental methods, with its analysis, with its milestones, those pitfalls and alternatives. You've addressed rigor of the proposed research. Now it's time to lay out your timeline and conclusion. So how long will all of this take? How long does each step take? What are you hoping to achieve at the end? What comes next? So what I tell people is that you're trying to sell the reviewers on the big idea. I think it's putting a little bit of that marketing background to work. How can you get the reviewers really sold on the big picture and have them very excited about wanting to be part of your progress and your next step? Sell them on that big, here's where we're going in phase 2, here's where we're going afterwards, here's how we're going to get it to patients or to customers, and then make it very clear and logical that this is the explanation for why what you're proposing now is that first step to get to that bigger picture. So having a good research plan is great, but it's not sufficient on its own. You're going to have supporting documents that go along with this as well. And so again, let's go back and read the solicitation. NIH and NSF are similar, but there are some differences. So for an NIH phase 1, again, read the solicitation, but in general, you're also going to need to include a summary, which is a standalone PDF of about 30 lines, a project narrative, 2 to 3 sentences as a standalone PDF. You'll have a facilities and other resources. You can have equipment either as part of that PDF or as a separate PDF. You'll have bio sketches that explain your team, and we'll talk more about some of these documents in a minute. But you'll have a bunch of documents that need to go along with this that kind of play into what you're proposing in that phase 1, providing more support to show that you can do what you say that you're going to do, and to also provide a little bit more detail and context for the reviewers. Something that's really important for NIH now is this data management and sharing plan. And again, they have a great website on that talks you through what you need to include in this document and also how you can budget for it. I will note that if you're doing vertebrate animals, you will have a separate vertebrate animals document. It's important that you include sufficient detail in that document because it will be a standalone document for some of the staff within NIH. They're not going to be able to go back to your research plan for that one. So you're going to want to include some details. And if you're doing human subjects or a clinical trial, you're going to have a lot of extra documents that you need to do to include with your application. So for NSF, a lot of the supporting documents are similar, but read the solicitation to make sure you know if they're a standalone document or if it's some information that needs to be incorporated within that 15-pager that you get for the phase 1. But a lot of them are very similar, so just know what you're being expected to provide. I will note that some of these documents could be made publicly available when you're funded. For example, at NIH, the summary and the narrative get posted on their website. So just be aware of what could be released to the public. And a hint for that one is when they include instructions, do not include proprietary information. Chances are that's one that's going to be made publicly available. Also, know what you need to have at time of submission versus time of award. I'm going to use the example of NIH. A lot of the institutes and centers, you have to have the IRB approval at time of award, but you don't have to have it at time of submission. That's not true for all of the institutes and centers. So you just want to double check that one before you apply. You will be asked to provide proof of IACUC or IRB as part of the just-in-time process. So let's talk a little bit more about some of the specific documents and how they tie into the SCORE driving criteria. So for environment, one of the places that they're going to be looking for information is with facilities, equipment, and other resources. And so you're going to want to show there that you have the necessary resources, facilities, equipment, community support around you to be successful. And so, for example, if you're proposing to do something with genotyping, well, do you have some equipment in place that will let you do that? Do you have a shared facility that has the equipment? Do you have a collaborator on the project that has the equipment? How are you going to access the things that you need? It's becoming increasingly important to address not just the technical resources, but also the commercialization resources. So if you're a new company, what can you access for small business resources? Do you have somebody that can help you with business mentoring? Do you know where to go to get support with IP or with regulatory? My suggestion is read the solicitation, The 2023 solicitation had some really good things in the instructions that they say that they want you to address. And that was in the Forms H guide for the NIH, where they tell you, hey, here are some things that we really want to see you address in the facilities document. So a lot of folks have virtual companies now where you might not have an office location. Reviewers tend to want to see that you have a physical space, and some of the agencies and the agency staff are really pushing for you need to have a location. I'm seeing it in some of the just-in-time requests with, hey, can you provide your business address? Can you provide a copy of your lease for these business resources and facilities? Incubator spaces can be a really great resource because not only do they have the resources for the research part, that technical part, but they can also help on the business development side, or at least give you access to people that can help with the business development side. I also tell folks to look at the broader community that they're in and see what resources are available to you. And thinking about environment, if you're bringing together a team that's not worked together before, for example, a new collaborator, you might want to also address how you're going to work together in these documents. How are you communicating? How frequently are you communicating? Something to show that you've thought about how to be successful from this standpoint. And if you're a team that's worked together a lot before, it's worth pointing that out to show that you've done this successfully before. I will say if you're a new PI without a long track record, you might want to include just a short section here explaining how you can access the resources that are going to help you with this sort of project management task. How are you going to manage this large budget and team and all the reporting that you're going to need to do? What's available to you to help you navigate this new challenge? And then, like I mentioned before, the local community. If you can point out that you've got a thriving small business community around you and you've got that support, I think it's worth including it in the facilities and other resources document. So some of what I'm going to say next about team is going to be a little bit repetitive, but that's just because it's really important. So bio sketches are something that we'll be including with all of our applications. For the NIH, you get to write a personal statement. I would suggest somewhat tailoring that for this particular phase one or this particular opportunity and really speak to your background, your past successes. It's a little bit of past success predicts future performance. So you want to give the reviewer confidence that you have the necessary skill set to be able to accomplish this phase one application. And if there's anything that you've done that you think would be helpful, for example, if you've got somebody on the team that has regulatory experience or business fundraising experience or technical experience or has had a project like this before or a company before, or you've managed this big grant before, these are all really great things to highlight in your bio sketch. So they're also going to be looking at the team a little bit in your facilities and other resources document about how are you pulling this team together and how are you going to work together. And then also, if you've not had this type of experience before, have you documented in various places that you have the necessary support so that the reviewers are left feeling confident that you not only have the necessary environment around you, but you have the right people on the project. And you can think about if you need to pull in consultants or subawards or other folks that can help out. So you've got some other project information to include as well. And my first suggestion on this one is, I know it's getting repetitive, but it's important to hear is go back and read that solicitation. For example, you might have to include that for report animals document. And if you do, you're going to need concise but detailed descriptions, a justification for why you're using this species and why can't you use something that's not an animal. And then also, how are you minimizing pain and distress? And are you using a euthanasia procedure that's generally recognized in the field as being appropriate? These are the types of things you're going to want to make sure that you're addressing because it'll come back with either a reviewer saying that this is inadequate or NIH staff saying that it's inadequate when you're in just in time if you're not addressing everything. So if you've already got an approved ICOOK protocol, a lot of this information is going to be in there. So for human subjects and clinical trials at the NIH, we've hyperlinked a couple of NIH decision tools here to help you figure out, is this human subjects? Is this not human subjects? Has this crossed the line into clinical trial? It's really important to know how the NIH is going to classify you so that you know which set of documents and the types of details to include. I will note that not all solicitations allow clinical trials. So if there is a chance that what you're doing counts as a clinical trial, you're gonna want to make sure, one, that you know that you will be classified as clinical trial, and two, that you're going to the right solicitation that will let you put in a clinical trial. There are also some solicitations that require a clinical trial. So if you're doing something that counts as human subjects instead of clinical trial, you're going to want to know about that early on and redirect to a different solicitation. I will note that the NSF will allow limited human subjects. They will not fund clinical trials. So they also use the same type of NIH decision tools. So it's worth looking at these materials if you're thinking about NSF as well. So once you've confirmed if you're doing human subjects or clinical trials, and if that's allowed, then you're going to need to describe, who are you working with? What are you doing with them? How are you recruiting them? How are you keeping them safe? And there's a lot of information that might need to be included. If you've got an IRB protocol, a lot of the information is going to be the same. So you can always start there to find what you need to pull over into the NIH documents. So we've briefly touched big picture on what goes into some of these documents and what you need to include with your research plan. Let's talk a little bit about phase 1 versus phase 2. Again, go back and read the solicitation. But one of the big differences at NIH is phase 1 is about proof of concept, proof of feasibility. And when you move into phase 2, you're no longer in proof of feasibility world. You now need to show that you're taking the necessary steps to move you towards commercialization and regulatory approval. And then there's also a difference in what you need to include in these research plans. So for phase 2, you're going to need to include phase 1 data. If you're going for a fast track or a direct to phase 2, you won't be able to have a header that says phase 1 data because you've not done a phase 1 yet, but you might need to include something like phase 1 equivalent data as a header in your direct to phase 2. And then your research plan is going to expand from 6 pages to 12 pages. And then you're also going to have a separate 12-page commercialization plan that you're having to include with the fast tracks, the phase 2s, and the direct to phase 2s at NIH. The other thing I would suggest is know when you need to put your phase 2 in, if this is a phase 2 that's following on from a phase 1 project. They have some language about how they expect you to submit it within 6 receipt due dates from the end of your phase 1 budget period. If you have any questions about that, I strongly suggest that you talk to your program officer. They are the ultimate guide in navigating the NIH. And if they don't have the answer for you, they will direct you to an NIH resource that can provide that answer for you. I think that's good advice in general, is when in doubt, talk to a program officer at the NIH. So for the NSF, things are a little bit different. They don't have fast tracks or direct to phase 2s. If you're going to put in a phase 2 at NSF, it has to be subsequent to a funded phase 1. And then your research plan is still limited to 15 pages on a phase 2 at NSF, but you'll have a separate 15-page commercialization plan, and you'll also have a 15-page phase 1 progress report. So really important to know the differences on the types of material that are required there. And then they also have slightly different language about when you should put in your phase 2 application. So in general, read the solicitation. Again, my number one top tip is really understanding what's required of you, what do you have to do, and how are you being evaluated, and also what's going to get you in trouble if you include it. Talk to the program staff. They are your go-to source for making sure that you're navigating the NIH or the NSF and that you're really giving them what they expect to see. One of the top things that I tell folks to do, draft your aims page, send it to a program officer, schedule a call, and then have a conversation about fit with that particular institute and scope of what you're putting into your phase 1 application. Another big tip, we've talked a lot about what to include, but not much about how to present it. I think it's really important to make this a document that's easy to read for the reviewers. They might be reading a bunch of these all at one time, and at a certain point, it all turns into walls of text. So anything you can do to make it more readable and easily accessible by the reviewer, bolding, underlining, bullet points, graphics are great. Figures, pictures, tables, again, going back to my suggestion of use a competitive advantage type of table in your innovation section. And for example, we have got an example that's just a wall of gibberish text, and it's really hard to figure out what's important in this section. How is it laid out? What's going on here? Now it's still going to be gibberish, but we've included some images, we've done some bolding, some underlining, some bullet points. Not only have we made it more visually interesting, it's a little bit more accessible to the reviewers. It might give their eyes a break after a long day. And you can also guide them to the main points that you want them to remember and take away. So be specific, be clear and concise so that everybody knows what they're supposed to take away. I really like in the preliminary data section, my header for each paragraph is the main point that I want the reviewers to take away. So it's not just I'm telling them I did this experiment and showing a figure. I'm telling them what the conclusion of that particular experiment was and what I want them to get out of the figure. It's really important to pay attention to page lengths and to page limits. Some agencies, if you are over the page limit, you can't submit, or your application is administratively rejected and you'll never make it to a reviewer. Whereas other agencies, they'll just strip off the extra pages, which is in a way equally bad because then the reviewers won't see everything that you want them to see. Try to get it down. I know it's hard on that 6th page at the NIH, but it's really important to be concise and get to the point for them. If it's something like the NSF where you have a minimum, like the 10 pages, it's really important to hit that minimum as well. And if you look at what they tell you the required sections are and how you're being reviewed, it makes it really easy for you to lay out your documents in a way that you're conveying the key points of what's important to that particular agency. Get other folks to read your work. I like having at least one other person, if not 2 or 3 that I really trust, to give me feedback and to tell me how I can improve and how I can make it more clear. If there's anything that they feel like there's missing or it's misleading or it's just not easily understood. I'm not the greatest at graphics, so sometimes I will give people my documents and say, hey, can you give me some suggestions on what type of graphics you think I should include? Or I included this figure. Can you think of another way to show it so that it's a little bit easier to understand? The number one tip from all of this, because I'm giving you a lot of work to do, read the solicitation, have multiple people review what you've written. There's a lot of writing to do here. Talk to a program officer. You're going to have to start early to do all of this. I normally will start 8 weeks, 10 weeks before the deadline and lay out in itty bitty steps what I need to do. So for example, NIH, I'm going to have to address significance, innovation, and different components of approach. I'll break it up and I'll give myself a due date for each of those sections or subsections. So I know I talked very fast. I'm going to give us plenty of time for Q&A, and I'd be happy to address anything that you want to talk about.
Thanks, Dana. We have a couple questions in chat that might be able to answer for the group. Someone had asked whether the key required skills for the application, does it make a difference whether you list a person as being part of the company or as a consultant, and which strategy might be better?
I sometimes will look at what am I asking that person to do and how much time and how much budget will it take for somebody to do? Because the other thing that you've got going on while you're writing all of this is trying to also make it match with what you're proposing for your budget. For example, if you propose an experiment that's going to cost $100,000 and you only allot $30,000 to it, you've got a problem. Because the reason this is important is because there's certain percentages that you're having to hit. And if you're going for a solicitation that says that at least 67% of your budget has to be internal to the company, and you've already got a couple of other consultants and external folks and things on the project that you're allotting budget to, you might not have room in your budget to add another consultant. So that might be where you start looking at, well, is there anybody within the company that has the same skill set? Alternatively, if you know you're going for a solicitation where you have to include an academic institution as a partner, as a sub-award, and they're having trouble hitting their minimum requirement, maybe it's something that's internal at the university that they can include. I think budget is where I always start in thinking about how do I want to include these folks. And then I also think about, well, do I already have somebody at the company that has these skills? Am I going to have to go out and recruit somebody? How hard is it going to be for me to find somebody that can provide a bio sketch or that can be onboarded before notice of award? Sometimes you just have to think about logistics of hiring too, but I would start with my budget. Brandon, do you have any other tips or tricks that you would like to include for that one?
No, I think that's a really great summary. I would say perhaps in addition, if you're very new and your company is recently formed, if you're considering listing someone as key personnel versus a consultant, consider what the relationship would be to the company at time of award. Whereas consultants would remain external, key personnel would be considered part of the company. A few other questions. One was actually also regarding budget and facilities. So this one asks whether facilities costs need to be explicitly indicated on the direct cost section of the budget, or when would it be better to lump such costs in with indirects on the budget?
So I like thinking about, is this a facility where I'm going to be doing a bunch of different things and it's going to be really hard if somebody asks me to justify the cost? That it's one of those that I really don't know. I got electricity for 3 rooms and I couldn't possibly tell you how much of my monthly bill was going to this particular project. If it's something like that where it's really hard to parse out what that cost is going to, it might be easier to include it in your indirects. However, if it's, I need to rent this vivarium to do these specific experiments for AIM 3, and the vivarium can give me an exact quote for just bench work and space and maybe some racks and cages for this one particular thing, that seems like it's very easily justified as a direct cost if I have to justify it. I generally think about, can you tie a direct connection to one of the specific aims or one of the tasks in the specific aims, and use that to help direct me as to if it's a direct cost. If it's a one-to-one correlation, and I can definitely tell you where this bill is going and how the money is being used, if you have room in your budget to make it a direct cost, you can probably justify it to the reviewers and to the program staff. But if it's going to be a little bit harder, like electricity and water and general overhead and business offices, and you can't tie it to a specific task, it's probably going to be easier for you in the long run. And it's probably going to be more compliant in the long run if you put it under your indirects or your fee.
Thanks, Dana. We have one more, and this is about formatting and sort of visuals on the
Mhm.
research strategy. The question was, would you recommend block justification or including things that are left aligned?
Honestly, my answer sometimes varies. Personal preference is block. I found though that impacts how many pages and how things are laid out. And sometimes if I am really struggling to get it within that 6 pages required for the NIH, if I change my left align to block, it sometimes will tighten things up. And suddenly those 3 lines that were on page 7 all now perfectly fit within 6 pages. Also, if I am struggling on an NSF and maybe I want to make it look a little bit longer, left align sometimes takes up a little bit more space. But I will say read the solicitation and make sure there's no requirements around how you have to do this. I know some agencies are very specific. For NIH, I think it might be more of a personal preference or what makes this easier for the reviewer to read. And it's something that you can, when you're asking folks to read it and give you feedback, you can ask them, hey, is this page easier to read like this or like this? What, I don't want to say pretty, but what looks pretty, what looks visually pleasing, and what's easy to read and draws the reviewer's eye to where you need their eye to go to. But do pay attention to formatting requirements. NIH and NSF will allow different font sizes, and they have some very different rules around line spacing. So it's something that you just want to make sure that you're following agency requirements for. Is there anything else that I can help answer for you?
There were some general questions about the team and what big skill areas need to be covered. We mentioned regulatory, the technical aspect, team management, and whether there's anything else that applicants should specifically consider including.
I think it might depend on what you're proposing. And sometimes you might have skill sets that are going to be needed in the long run that you don't necessarily need for the phase 1 project. So sometimes I like talking about my broader team. For example, I've got somebody that has a lot of fundraising experience. I don't really need them to do that in phase 1, but they will be available to us and will be added to the project team in phase 2. Regulatory, if there's anything that you need to consider with reimbursement, that might be something to think about in the long run. I would make sure to start with that you have everything covered from project management and technical, and then start building from there. Again, this is another really good one when you're asking folks to read it is, hey, you've read this. What type of skill set do you think I need to be able to highlight? This is really good if you're getting somebody to read it that has a technical background where they can understand the technical skills that need to be included. Something that I often see a lot are reviewers asking, hey, have you considered the clinical viewpoint of this? How is this going to get integrated into the clinical workflow? And sometimes folks address this by including a letter of support from a doctor or from a nurse. Sometimes folks talk about it by saying, hey, we're going to include a clinical consultant and get their feedback during phase 1 about this prototype. I often see that with devices, especially surgical devices. Let's get this in the hands of somebody who's going to use it, and they can tell me how it's going to be used in the clinic and how it's going to fit in with workflow. Clinical is something that you might want to consider. The other thing I will point out, it kind of touches on budget, but it also talks about team and what are you going to need for long-term success. Look at the technical and business assistance programs and services and resources that are available to you. And it might be on your phase 1. You don't request budget for that TABA, technical and business assistance, but you partake in the free TABA resources that the NIH provides to phase 1 awardees. and have them review and tell you what type of expertise that you're going to need in the long run. I've gone through TABA with a couple of clients and gotten some great feedback about regulatory and clinical and marketing and all sorts of things that they need to think about in the long run. I've also sometimes included just a brief sentence when I'm talking about IP, about what IP law firm or IP attorney that you're using. So that's something to think about including in your team long run too, of how are you addressing IP and making sure that you're staying on the right side of IP and not infringing on somebody else's patents. Who's doing that freedom to operate analysis for you?
I have one more that pops up in the chat, and this one is a bit of an accounting question. But this is about the R&D budgets now being taxable with the recent initiatives and what someone might want to consider when putting together an application.
I think that's one that you might want to talk to your tax accountant on. I'm not a tax expert, but I know it's something that is top of mind right now. I believe the EGC website has some information about this particular part of law and what's going on with it in recent updates. The NSF has been putting a lot of information on their website as well. So the NSF website, it's something that they're even asking folks to address during the pre-award process, just to make sure that you're aware of the taxable aspects of it and that you have a plan. But I would start with whoever's doing my taxes, start with that tax accountant. Do we have anything else that I can answer, or do we want to wrap up a minute or two early and I'll let everybody get on with their day? I'm happy to answer one or two more questions if there's anything at all that you have on mind.
I do think there are two more regarding TABA.
Okay.
One would be in relation to TABA. If we were making requests, do we need to have a destination for the funds in mind? And related to this, is there an NSF equivalent of NIH TABA?
So I believe, it's not been released yet, but I believe that when the new NSF is released, that they're going to be including more information about TABA and how to request TABA in your phase 1 application. I'm not aware of NSF having a free TABA resources like the NIH does, but that could always change in the future. So NIH has two different things that are considered TABA. There are things that you can request in your phase 1 application for TABA. So you're requesting budget and you're kind of in charge of finding who's going to be doing this work and defining what the work is. And you're going to want to address that in your budget justification. My suggestion is talk to your program officer, make sure that they'll have the most up-to-date information. So make sure that you've got the most up-to-date requirements and everything. What I like doing to show the reviewers and the staff that have thought about it is earmark, hey, here's who I'm going to be giving this money to, and here's specifically what they're going to be doing, and including a letter. It just shows that I've really thought about it and have a plan for the funds. But I think there's a chance that you'll talk to a program officer who says, hey, you don't have a plan yet, request it and we'll figure it out during just in time. But that's one, talk to your program officer. They also at the NIH have an option where if you don't put TABA funds on your budget, you can request free TABA services once you get that award. I would direct you to the NIH TABA website because I think they have some really great descriptions of the difference between requesting TABA budget to get something specific done versus getting the free TABA services. It's a TABA needs assessment that can help point you in the right direction for your phase 2 on that one. I will say I like using the free services at NIH for my phase 1 and then requesting something specific for a TABA person on my budget on my phase 2, but that's personal preference.